Hello, everybody. We'll get started in a few moments. Greetings, everyone. We're going to get started now. Thank you so much for joining. My name is Eric Stevens. I'm the Vice President of Marketing with 4Point. And in this session, what we're going to talk about is use cases, specifically in healthcare around Adobe Experience Manager, and how 4 different organizations have used Adobe Experience Manager to change the way they interact with their customers and to change how they manage their operations internally. I'm going to cover 4 different use cases with 4 different customers that we've worked with. 3 of them are in healthcare. One is in government, but I think that the government use case is very relevant to the healthcare industry. On the right side of the screen, you should be able to see the question and answer section. You may have to pop it open using the little icon in the upper right-hand corner. If you do have any questions as we're going through, please feel free to type them in there, and we'll try to address them either as we're going through the process or towards the end of the session. To get started now, the first one I'd like to talk about is customer enablement. And in a customer enablement scenario, there are really 2 different aspects of it. One is the data entry aspect of customer self-service. Customers want to access and submit information online. Now, in many organizations, you can use basic HTML forms. That's entirely possible, but they often require effort. They require work. They require developers to develop that in your organization. And they're often very difficult to maintain because it's actually a piece of code attached to a specific page in the website. And customers need options to be able to work with your organization and send data into it. In some cases, paper fill and print is still required. We talked to life and health insurance organizations where some people just don't have access to the tools, and so a paper-based mechanism and then back-end data entry is still a viable approach and is still a desired approach to it. Some people want to download, fill, and submit it electronically, and so a fillable PDF form is still a viable mechanism there. But more and more consumers and individuals working with healthcare organizations want browser-based, dynamic, intelligent forms. They want mobile-based forms that are pre-populated with their data. When they log in, it automatically knows their name, their address, their current situation. It knows their health plan. It knows the information about them that the organization has. And that means that those forms need to be integrated with back-end systems. And often that level of integration, that pre-population, can be complex when you're dealing with the basic HTML forms. But there's another aspect to customer self-service, and that's when the individual has submitted some information in, but they expect some information back out. They often need documents generated for them. These could be statements about their current situation, could be financial statements, could be reports, could be approval or denial letters. I'm sorry, your health claim was denied for the following reason. And consumers expect that these documents should be personalized, customized, available whenever they want them, and available to them in browser and mobile-friendly ways so that they can see that information on whatever device that they're using whenever they're using it. And so Adobe Experience Manager lets you build the kinds of customer self-service environments that consumers are expecting from all organizations, but they're also their healthcare providers. You want to be able to build mobile, dynamic, browser-based environments that allow people to enter information, that are intelligent and can validate that information right on the mobile device without an extra effort on your part, but without any extra effort on the patient or the consumer's part. You want to be able to produce documents that know about the person that they're sending them to, that are already personalized, that filled out that information, and can send that back down to them easily. Let me give you an example of CVS Caremark and how they used Adobe Experience Manager to address one aspect of this customer self-service. So they're a leading provider of pharmaceutical benefits, and specifically SilverScript Insurance, which is a division of CVS Caremark, provides prescription drug plans to people on Medicare. And they were producing generic health plan documents that were being sent out to all of their different members. And often they were inaccurate. They were missing information around supplementary coverage. They often included items that didn't apply to the member because they were generic boilerplate documents that were being sent out. And this resulted in a back and forth communication of the member attempting to understand what their actual drug plan was and where they were in the drug plan. And so internal analysts inside of the SilverScript Insurance would spend hours creating custom documents that they would send back out to these consumers. So there's frustration in both places. And mailing the documents back and forth, getting the responses, getting on the phone, labor-intensive, time-consuming, and frustrating for the analyst and for the consumers. So what CVS Caremark did was they utilized Adobe Experience Manager for the automatic generation of customized, personalized health plan documents. So the member could now go online, request the document, and then that would be linked into their back-end systems. It would take a standard template structure and would merge in the appropriate information based on the back-end data that had the accurate information about the health plan. It brought the accurate information and the up-to-date information so that if a situation had changed or if they were tracking actual prescription payments, we could see this is exactly where you are on your prescription health plan. And what it did was produced on-demand generation so that the individual got that exactly accurate health plan document presented to them, delivered in the form that the member preferred. If they wanted it in the browser, if they wanted it via email, if they wanted a PDF document, they wanted it by regular mail, we could actually print it and regular mail it. This resulted in a significant cost reduction because now the analyst was only administering documents in special cases where the system couldn't handle it, and now they were doing as little as 20 minutes per week rather than 20 hours per week. And this really also meant that the members got a better product. The members were getting a better customer experience while the organization was saving money. And this is a recurring theme that we see is as organizations put these kinds of tools in place that allow them to better serve their customers, better serve the consumers, better serve their patients or their members, they're also reducing their organizational costs and speeding up the time that it takes to deliver these things, even though they're highly customized and highly personalized. The next area that I want to talk about is document security. And often we see organizations, and this example is going to be a government organization, but we see it in a wide range of different industries, and healthcare is no exception, where they have documents that need to be distributed and protected. And often these are not customer-facing documents, but they could be. But often these are documents that they're distributing internally, distributing to critical partners, distributing to regulatory bodies, and they need protection. They need protection in multiple different ways. The first is they need to ensure that only the approved parties can view that document. If you are sending out a highly sensitive document that is to go to a regulatory body, you want to ensure that only those appropriate people in the regulatory body can view that document. When you're sending it out in a broader scenario, you want to ensure that no tampering is possible. That when you've sent that document out, that individual receiving it can be assured that that document has not been tampered with. You also want to prove the authenticity of the document. You want to be able to prove to the recipient of the document, to the person receiving it, that that document is the one that you intended to send to them, and that in fact you are approving and blessing this document. You also want to be able to remove access rights. You want to be able to send it out and say, that person is no longer allowed to see this document. Or expire documents. That document is no longer the most up-to-date document. Please go to the website to download the most up-to-date document, or please contact X, Y, or Z to be able to get the most up-to-date document. And this is what we classify as document security. Some examples that might apply to your organization: material safety data sheets, reports, clinical trials, research documents, pricing information. We know on the manufacturing side that often organizations send out multiple different pricing information and pricing models to different partners at different tiers, and you may want to lock that down so that it doesn't get into competitors' hands, doesn't get into customers' hands, doesn't get into the wrong partners' hands. So there's many different kinds of documents that might need this security. One example is the government printing office in the US. The US government printing office is the official disseminator of all government documents for all branches of the US government. It produces documents for 130 departments, often with competing requirements for the nature of the assembly and the delivery of those documents. So the GPO has to regulate and manage all of this. They assemble and distribute millions of documents per year from multiple different formats and sources. And they prove to the recipients, usually the citizens of the United States, that the documents are the original documents, they are authenticated, and they are approved by the GPO. They ensure that the documents cannot be changed, and they need to expire older documents, and it needs to be available to all users at no cost. And they were able to do this using Adobe Experience Manager and PDF assembly. So the documents are automatically assembled, they're automatically produced into a PDF from potentially multiple different sources. So you could take a Word document, another PDF document, merge those together. And then an automatic application of an electronic seal using digital signature technology protects that PDF and validates that this is the authentic environment. And actually, when people receive the PDF documents, they can actually check the signature to ensure that this is the official document. They implemented strong protection using Adobe Acrobat and the Document Cloud. This has made it available at no cost to users. They can easily download Adobe Acrobat. And because it is only readable in Adobe Acrobat and in PDF, and not available inside of the browser rendering of PDF, because we can block that also, now Acrobat has control of it and can say, this is no longer the official document. It can expire them and say, you're not allowed to see this. It can say, you're not allowed to have this because you're not on the list. It can provide things like passwords, where someone has to enter a password to be able to view that document. So there's a lot of different security that we can layer into that. And not only is that reducing costs, but it's allowing the GPO to distribute a massive volume of documentation out more effectively. It allowed them to put a search mechanism in place that allowed for all of the documents produced by all branches of the US government to be easily and quickly searchable and delivered to citizens whenever and however they wanted that information. The next one I want to talk about is maintenance and inspection. And this often applies to more equipment-oriented scenarios, but it may apply in situations where we're talking about examinations in patients. It could be inspections on pharmaceutical processes, manufacturing processes associated with it. It could be inspections on facilities. All of those different kinds of things are what we're talking about here, where someone needs to go out into the field, gather data, potentially gather information, take pictures, talk to individuals associated with it, and where the data associated with that needs to be auditable, tracked by multiple different organizations, usually by the healthcare organization, potentially by the customer or the patient or whoever is running the facility or whoever is doing the manufacturing, and by the regulatory bodies who care about that particular activity. And we see this in many different circumstances where it's complex to do this because it can be very, very difficult to know what kind of data connections you're going to have, what kind of application that you need for it. There may be an organization may be tasked with performing inspections on hundreds or thousands of different types of equipment or facilities, or different types of examinations or different types of inspections. And that creates a tremendous complexity in trying to address all of the different ways that we need to capture the data, present the data, help the inspectors, help the people who are performing the examinations or the maintenance, help them work through the processes that they have to deal with. So it can be often very, very difficult to try to build applications or systems that do all of this kinds of thing. GE Healthcare had exactly this kind of a problem with hundreds of different types of equipment. They produce the diagnostic equipment used in many hospitals throughout the world. They have thousands of different checklists, maintenance procedures, processes, all connected to complex manuals and instructions with a critical need for clear tracking and supporting information for all of those equipment. And in many cases, they have very limited connectivity when they're going in to do an inspection. If someone needs to go in and do preventive maintenance on an MRI device, they may or may not have access to Wi-Fi while they're investigating the situation with a particular diagnostic piece of equipment. So this was a tremendous challenge for GE Healthcare. And the complexity of trying to give the technician who's going out and doing the inspection all of the material that they need to be able to actually do an appropriate piece of inspection or preventive maintenance on the equipment and then have it trackable at the back end was a tremendous difficulty. And what they were doing was basically paper. Someone would sit down and they would grab the form that they needed. And then they would scratch out the sections that were no longer applicable. Then they would grab the other form that they need. Oh, I need preventive maintenance on this piece of equipment. Oh, and I need this. And then they would carry around all the manuals that they needed for it so that when they got there, they would be filling out multiple different forms as they went through the process. And then they would be referring to the manuals and flipping back and forth to figure out what they needed to do for this particular maintenance procedure. So what GE put in place was a mobile form that is dynamically assembled for the specific inspection. What the technician would do is come in and start their day and go, I have scheduled these preventive maintenance visits. I will go through, oh, it's this customer, it's this piece of equipment that I have to do. And then once they'd selected that, the form would dynamically adjust itself and present them with the checklist that was appropriate to the equipment, the customer, the schedule, and any other past issues that may have occurred that had been kept in the system and are now reflected in the form, oh, please check this piece associated with it. What it allowed was the separation of what the technician needs from what the government, customer, and manufacturer needs. We're going to gather that information, what the government, customer, and manufacturer need. We're going to pull that information in, but we're going to give the technician what they need to go through the appropriate steps so that we can be assured that they have performed the appropriate maintenance. It also added the ability for things like photographs, notes, issue escalation, so that we're creating a complete archive of the inspection. If the technician goes in and goes, oh, well, that board has to be replaced, he can take a picture of it and go, this is why the board needs to replace. I replaced this board, and now we have an auditable archive that anyone can go and look at. Again, that customer can go and look at it, the regulatory body can go and look at it, or GE themselves can go and look at it to ensure that they're doing the right thing with all of the different pieces of equipment. And what this really did was give everyone a level of assurance that the maintenance was being performed correctly. And what that did was effectively reduce the risks associated with non-compliance. If you're not assured that a piece of equipment is being maintained, then that means you need to shut that equipment down until you're assured that it's being maintained correctly. And that resulted in longer wait times for patients, and that resulted in frustration inside of the hospitals or the clinics. So by improving the maintenance processing and in reducing the risk associated with non-compliance, you're increasing the customer satisfaction, the patient satisfaction associated with it, and making the healthcare organization much happier and much more assured that everything's being done correctly. The last situation I want to talk about is patient enrollment. And there are many, many different circumstances where healthcare organizations need to gather patient-related data. It could be eligibility, it could be enrollment processes just for entering a hospital associated with it. It can be insurance enrollment processes. It can be member enrollment processes such as CVS Healthcare. But one of the challenges that you've got with this is that the filling out of all the forms is often a very complex process. It requires the patient to understand a lot about the questions that they're being asked. Think about a health plan insurance scenario. I have to give you a lot of different pieces of information about my background, about my health situation. I have to answer the questions as clearly and effectively as possible, and often I might not have that information at my fingertips. What we want to do is we want to simplify the data gathering so that it is easier for those individuals to be able to provide that information, whether we're doing it in an assisted manner where we have a representative who's helping the patient fill that information out, or whether they're doing it in a self-guided scenario, a self-service scenario. We want to reduce errors. Often in the situations we do now, we have paper forms, people fill out paper forms, then they go in, somebody enters it, they enter it incorrectly. That increases the error rate associated with it and makes it more complex to catch those errors. Those errors can cascade all the way down through the entire life cycle of the healthcare treatment that's going on for that particular patient. But we need to also support documents, evidence. We might need driver's license. We might need other health-related documents associated with it. We might need to take pictures of the prescriptions that the individual is on at that point in time. We want to bring those all together so that they're all in one place. And of course, these need to be integrated with the back-end systems. It needs to fill the data out into the back-end systems, but it also needs to pull information from the back-end systems and be able to push that information in front of individuals so that they don't have to re-enter things over and over again. And this was the situation that Change Healthcare had. Change Healthcare is an eligibility and enrollment service. They qualify patients, often patients at need, for coverage. They help hospitals by optimizing reimbursements, and they provide financial counseling. What they do is they go into hospitals where patients have challenges associated with their insurance and may be struggling to get the appropriate level of care because of a lack of insurance. And they assist the hospitals in screening and submitting the applications into various different government, federal, state, or other organizations that might be able to provide insurance to assist the patients. And they help the patient go through the process and submit the applications and adhere to all of the appropriate regulations. The key to the patient is this allows them to secure vital health care coverage, often at a moment of need. And it provides them with assistance. There's a representative who helps the patient with assistance in the complex enrollment process. And what we did with Change is we took this manual paper-based enrollment process, and this involved going to the patient, screening and interviewing the patient, returning to the office, completing the forms, copying the evidence, going back to the patient to get the signatures that are necessary to submit the appropriate applications, then completing all of the applications, having those reviewed and scored, having it updated, updating the applications, then sending and producing all the appropriate documentation that then needs to be scanned, and validating all of those scans. So there was a detailed process to go back and forth between the representative and the patient in order to gather all of the appropriate information. And throughout this, the potential for error was significant. And often what would happen is it wouldn't go as smoothly as this complex process that I'm showing you here. What would happen is they would screen an interview, they'd go back, they'd prepare the forms and realize that they'd missed some information, or that information for two different applications was contradictory. Oh, you said yes over here, but you said no over here to basically the same question. That's a problem. Which is correct? So the return to patient might be a return to patient to correct the information. Then they have to go back and prepare the forms again to get them right. Then they can obtain the signatures. So there was a lot of back and forth, a lot of complexity. All the while, the patient is often in hospital awaiting care. So this produced a tremendous amount of stress on everyone associated with it. What they did was created a digital enrollment solution, a mobile device that operated offline because they couldn't be sure that they would have effective Wi-Fi in all of the different locations. A lot of that is changing now in hospitals, but when they put this together, they couldn't be assured of that. So they put it together in an offline scenario. That dynamic referral form now guides the representative to assist the patient to answering all of the appropriate questions that are necessary. And when a question is duplicated on multiple different applications, we only ask it once so that we've got one answer that we can propagate across all of the different insurance applications that are going to come. And they're intelligent, so that we know that certain things won't be asked if you've answered certain ways earlier on. For example, if you identify as a male, then you're not going to be asked about female-only situations. That allows the representative to walk through the process more effectively, more efficiently. We introduced digital signature technology. What this allowed is for the patient to approve that these answers that I have provided to you are the correct answers. We give them a mechanism to review all of those answers in a clean, crisp way, so they don't have to look back and forth between all sorts of information. We added evidentiary capture so that we can scan any information that we need. We can scan driver's license, prescriptions, other health records, whatever is necessary as supporting documentation associated with it, which helps us create a complete and cohesive record that is going to go forward. And we built in data integrity checks so that it cross-checks multiple pieces of information, not just from a validation perspective, but also from a logic perspective, more than just making sure that the same answer shows up on the same question in the same insurance form. This also cross-checks, wait, if you answered A to that question over there, then answering B to question over here might be an indication that something else is out of sync. So there's a series of data integrity checks. It also ensures that the representative doesn't miss anything, doesn't scroll past a question, doesn't miss a question that may be necessary because of the other answers that have been provided. What that means is that at the time that the representative is talking to the patient, they are gathering all the information, they are reducing the error rate, they are getting accurate information that they need, and now they can go back and connect that to their legacy systems and automatically upload that with a much higher degree of confidence that the data that's captured in one pass, in one sitting with the patient, can all be submitted appropriately to get the best insurance option for that patient at that particular time. By adding that digital enrollment process, we took this manual, paper-based enrollment process and shifted it from this multi-stage back and forth, writing down on paper forms, copying it into applications, printing it out, going back, getting signatures, updating other applications, submitting it in. and we changed it to just this. We load the forms, we enter and review it, we travel to the patient, we screen and interview, and we fill those forms offline while the patient is there, using our edits and audit checks to ensure we're gathering the correct data. Then the representative returns to the office, prepares the forms, and they're automatically submitted because all the data is there as needed. And what we've done is separated the way that the insurance providers need the information from the way the patient provides the information. And this is a critical message across all of these different stories, that what a patient can provide to us doesn't have to be formatted in the way that an application or an insurance provider or a maintenance technician or a regulatory body needs that information. We want to separate those two things to gather the information in the way that makes sense for the data capture part, and to deliver the information in a way that makes sense for whoever needs that data, whatever it happens to be. By using this, Change Healthcare was able to scale it to a high number of representatives, and they saw a 46% decrease in average processing time. It provides, at the time that this information earlier this year was taken, is over 1.5 million screenings and 130 or more hours in labor savings every day. But most importantly, a substantial increase in patient satisfaction and a substantial reduction in the cost for both the hospital and for Change Healthcare. So what I've talked about is 4 different use cases: customer self-service, document security, inspections, and patient enrollment, as 4 different ways of thinking about the kind of technology that Adobe Experience Manager can help healthcare organizations to address the challenges that they're facing when they need to capture data, present data, or process information to better serve patients, customers, and to better address the compliance and regulatory issues and the challenges around those regulations. If you have any questions, please feel free to contact us, sales@4point.com, or visit our website, www.4point.com. Thank you very much for your time. Really appreciate it. Bye-bye.